I'm Michelle Tucker, President and CEO of the United Way of Greater St. Louis, and I wanted to take a moment to say welcome. Welcome to our forum and our conversation this morning. We will be focused on behavioral health. I hope that you are all safe and warm in your homes. Thank you for the quick pivot. We decided to host this forum virtually because we just didn't know what the weather would produce. I mean, we saw the reports last night and we said, oh gosh, we need to pivot. So thank you for being so flexible. So today's conversation, as I mentioned, is focused on behavioral health, and it's brought to you by the United Way of Greater St. Louis in partnership with Focus St. Louis. Now, these conversations came about as a result of some conversations that Yami and I had it was before COVID. And we talked about the opportunity to broaden our audience and bring the community's top priorities to the forefront. And so with that, we have decided to have broader discussions around not only behavioral health, but affordable housing and essential needs and jobs and transportation. So stay tuned for the jobs and transportation conversation coming up. And I know you saw on the screen the date and the time for that. So make sure you register. Without further ado, I want to turn things over to Regina Greer, who is our moderator today. She is the Chief Impact Officer at United Way of Greater St. Louis. Regina, I'll turn things over. Thank you.
Thank you, Michelle. Thank you. Good morning, everyone. I want to echo Michelle's sentiment and thank everyone for joining us online this morning and for the quick pivot. We're grateful for your presence and for joining this discussion due to a virtual platform because of the weather, and we dare not want anyone to not be anything but safe and sound. So thank you for that. I also want to thank the Focus team, Wally Seward and Michelle Connell-Stevens in particular, for steering the ship this morning and ensuring that we could all still connect and that the panel would also be able to continue without interruption. So grateful for all of the Focus team's work in getting us to this point. As Michelle said, our topic today, and as you noticed when you registered, it's behavioral health. And when we think about the overall health and vitality and success of our community, we know that behavioral health is taking a more priority stance every single day if it was never, ever a priority before. I liken behavioral health at this point to a basic need. It is just as important as water and energy assistance and housing and all of those things that we need to survive. And so the ability for us to have a healthy behavioral health stance across the community and within our family structures is tantamount. And these services and supports that we need across the community are definitely needed at a greater clip than ever. We've seen this because of the traumas that we witness every single day in our community. They're hallmarked by the recent CVPA shooting, yesterday's shooting at the University of Virginia, the traumas of senseless violence that we see within our neighboring footprints, and then just simply the continued stressors from life. You know, those things that we are still recovering from, like a lifetime pandemic, as well as other daily stressors. So it is a definite need. It is so necessary. And what we do know more than ever is that there's a need for more in this space, more recognition, more acknowledgement, more normalization, more access, more innovation, more willingness, and more treatment overall. So this is the focus of this morning's conversation as we continue our discussion series on the overall vitality, success, health of this community. And even though we're virtual this morning, we're still not going to have a one-sided conversation with you all today. You all will be able to go to, and if you look in the chat, you'll be able to go to menti.com to post questions for the panelists. We're using Menti this morning and not the Q&A feature in the panel. So please follow the directions that are posted to access Menti, and then you will be able to post your questions and we'll be able to pull from there. And I want to thank Wally in advance for monitoring the questions too. So now today we're going to delve deeper into our dialogues around equitable access, streamlined navigation, and accepted normalization in the behavioral health space. This will span across our communities and the populations that we serve. We are so grateful to be able to sit at the proverbial feet of our expert behavioral health panel, who are going to illuminate us, leveraging their experience and leadership across these three core topics and explore even subtopics of youth, adults, and policy strengths and opportunities to help us reach the goal. So it is my pleasure to introduce to you our phenomenal panel of four passionate, purposeful, principled, and pragmatic leaders who are both local and national experts in the behavioral health field. And as I introduce them, they will each come on camera so that you can meet them in person. First, we have Pat Holterman Holmes with Youth in Need. In 2013, Ms. Holterman Holmes became the fourth CEO in Youth in Need's history. A key youth in need staff member since 1990. She has extensive experience in the areas of mental health counseling, child welfare, positive youth development, and organizational development. She also makes diversity, equity, and inclusion a strategic priority at Youth in Need, driving the agency's work toward racial equity and LGBTQ equality. Ms. Holterman Holmes currently serves as the National Network for Youth Board of Directors and previously served on the boards for National Safe Place Network, Missouri Coalition of Children, and the Community Council of St. Charles County. She also represents the needs of vulnerable children and youth on various regional committees, including the Children's Safe Coalition. Thank you for being with us this morning, Pat.
Good morning. Thank you, Regina.
Next, we have LaTanya Mackey with Provident Behavioral Health. LaTanya Mackey has more than 10 years of experience working in the social service sector, providing treatment to at-risk populations or assisting those in need gain access to resources, including mental health care. LaTanya received her Bachelor of Science in Psychology from Truman State University and a Master of Arts in Counseling from Webster University. Currently, LaTanya works with Provident Behavioral Health as a clinical site supervisor with extensive knowledge and experience treating adults, children, and families where they are in the community. At Provident, LaTanya also serves as the supervisor for the Early Access Center, which provides low-cost, same-day, next-day counseling appointments for community members in immediate need. She trains and supervises rising mental health professionals who serve as therapists in the Easy Access Center. When she is not serving in the role of supervisor, LaTanya is also providing therapy to her own clients. Welcome, LaTanya.
Thank you.
Kim Feynman is with the Missouri Department of Mental Health. Kim is the Regional Executive Officer for the Eastern and East Central regions of the Division of Behavioral Health within the Missouri Department of Mental Health. The Division of Behavioral Health, DBH, manages programs and services for individuals in need of mental health and/or substance abuse disorder treatment services. The DBH provides policy guidance, regulatory oversight, and technical assistance to contracted agencies within the state of Missouri, ensuring prevention, treatment, and recovery services are available in the community. Additionally, the DBH supervises the operation of facilities, including all state hospitals, psychiatric rehabilitation centers, mental health centers, children's psychiatric programs, and one child's residential treatment center. The division also oversees community-based psychiatric services, and Mrs. Feynman has over 30 years experience in the behavioral health field. Her tenure with the state of Missouri has included the position of Chief Operating Officer for the St. Louis Forensic Treatment Centers North and South, where she has had operational oversight of 280 inpatient pre- and post-trial forensic patients. She received her master's in health services management from Webster University and her BS in criminal justice from Murray State University. And she has served on the Missouri Credentialing Board, where she was the chairman of the Ethics Committee. Thank you for joining us this morning, Kim.
Thank you, Regina.
And our fourth panelist is Tiffany Lacey Clark with Behavioral Health Response. With 17 years of experience in public-private partnerships and leadership development, Tiffany Lacey Clark brings an experience of excellence in meeting the safety and well-being of children, families, and adults to BHR. As a results-oriented leader, she is continuously striving to improve the way we serve those in need. Tiffany's solid background leading cross-functional teams and operations management has led to multiple successes and given her a deep understanding of the industry trends that impact growth. Tiffany is a solutions-focused administrator with a comprehensive background in policy and procedure development, strategic change management, organizational development, and continuous quality improvement. She brings a perspective grounded in compassion, emotional intelligence, and strategic insights to the BHR leadership team. Tiffany, we're grateful to have you this morning.
Thank you, Regina.
So audience, didn't I tell you that we had a phenomenal panel? Now let's get their voices into the atmosphere. So ladies, if you can all turn your cameras on, we will move forward and we will start our dialogue. So we're just going to have a conversation about this important topic. And again, sitting at your feet, I know we're going to all learn some very profound things from you this morning. So we're going to begin the discussion with a lens toward equitable access. Health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. So my first question for all panelists, think of this question: how is your agency or organization being intentional about ensuring equitable access? And what more should we do as a community to encourage youth and adults to seek services and treatment in the space? Please advise any new or innovative approaches you have found successful to level the playing field. So I'd like to take that question in the order of Pat, then LaTanya, Kim, and then Tiffany, you'll close us out on that question.
Okay, thanks, Regina. Again, I'm Pat with Youth in Need, and we have a whole network of support and services for children, youth, and families throughout the Eastern Missouri region. And I think we really try to bring the services to where the children and youth are in the community. And one way we do that in particular is we partner with schools to embed master's level therapists. So to provide those mental health services within the school setting, we have therapists in over 50 schools, elementary, middle, and high schools throughout St. Louis County, St. Charles County, and Lincoln County. And we prioritize partnerships with schools that are in the most the least resourced area. I was going to say the most under-resourced, but that's kind of a weird way to say it. Being in the schools, I think, helps normalize mental health and destigmatize it in a lot of ways. We have many cases where students bring their friends, to see a counselor. And so they're just part of the school culture and the school day. And it also helps with influencing the culture at the school. Having those therapists be part of the school can help bring a more trauma-informed approach to schools as well, and help them understand how basic needs, including mental health, are very integral to school engagement and success. We also have counseling and other services at many other community partner locations, everything from early childhood centers to domestic violence shelters, to a church, and a boys and girls club. I would say the other thing that helps us make our services accessible is because of our wonderful funding partners. I would highlight in particular the United Way, the St. Louis County Children's Service Fund, and the St. Charles County Community Resource Board. Because of their support, all of our services are completely free. So insurance coverage or lack thereof is not a barrier.
Great, thank you for that. I appreciate that. And in talking about friends bringing other friends, I think that is really, really key. So yeah, LaTanya.
Hi, like I said, or you said earlier, my name is LaTanya Mackey, and I just want to highlight a little bit about what Provident Behavioral Health is doing to be intentional in this space. The thing that comes to mind to me is that we're ensuring that all of our programming meets our mission needs to provide services for those most in need. So just to give you a little bit of background, 3 years ago, we made some significant changes by adding additional programming to meet community needs, including revisions or updates to our Provident Crisis Services Department, which offers 24/7 telephonic suicide prevention and intervention support, continuing to provide affordable therapy in our counseling offices. And we have 3 in the metro area. We have some therapists that are in Jefferson County as well to provide support to Southern Missouri. And and in those offices, we offer counseling services to youth, adults, and families. We also added a psychiatric services department 3 years ago, which offers medication management, because we know that that is such a need in our community for those who need psychiatric care, not to get it just from the hospitals or emergency rooms. So we have outpatient care that we added to our support. And then we added our Easy Access Center also to provide immediate need for those who are seeking help, that can't wait for a counseling appointment, can do that in person for $5 just a session. I think that we encourage the community by making sure that we're visible. So we've increased our marketing needs. We have our therapists and staff members in the community letting people know that we are here. We resource and provide information to community resources to let them know when we have updates, when we have openings, to make sure that people of all ages know that we're here. For me personally, it's great to see how many more people we've helped in the last 3 years because of the services we provided and how we've increased that care.
Thank you, LaTanya. Thank you. So I'm picking up on some things here, right? So this affordability, and you talked about easy access, and Pat, you talked about, being sure that it was free or, accessible for folks from a cost standpoint. So that's awesome. Thanks, LaTanya. Kim.
Thank you. I'd like to thank the United Way, Regina, Dr. Seward, and Focus St. Louis for hosting this forum to discuss such an important part of well-being and health. The Department of Mental Health has undergone a significant transformation over the last 2 years. We have a new director, Valerie Hune. We have 2 new division directors, Nora Bach for the Division of Behavioral Health and Jessica Bax for the Division of Developmental Disabilities, and a number of new faces in key leadership positions. I'm excited to say that this is the first time in our history that the department has been led by a team of women. I think that has changed some of our scope. The department recognizes that doing business as usual is not effective. We have had previous initiatives that, while very well intended, caused some greater disparity in the availability of services in our region. In an effort to address the inequity in our region, St. Louis City and County have been identified as a top priority for funding and expansion of services. Our first priority has been to address the lack of behavioral health provider locations in North City and North County. In order to ensure equitable access, we have to ensure service availability. Once we have established ready availability, then we can utilize community-based organizations to engage the community members in dialogue about mental wellness as an accepted piece of overall health. We have to have buy-in from community organizations. And with the help of community organizations, we can look to bring much needed services to the community. I mentioned moving away from business as usual. A big piece of that that we've learned, especially through COVID, is expecting individuals in need of services to come to us, to brick and mortar buildings. And we recognize that that really is not an effective way to reach those in the community. And what the department has been very intentional about is providing access to the community in the community. So rather than having individuals come to brick and mortar locations, we've invested in mobile units. We've invested in outreach services in an attempt to incorporate mental health, substance use disorder treatment into primary care. And I think that is going to be the future of how we deliver services going forward.
Yeah, that's important. Interesting that this business as usual does not work, right? And I think that's something that when we delve into some of the other questions about what we learned through COVID, I think that is a key thing for us to draw on. And then looking at this do no harm approach, what can we do to be sure that everyone has access? So I love that. Yeah. So Tiffany.
All right, good morning. This is a really great conversation already. So for BHR, for the last 28 years, our mission has been to provide immediate and barrier-free access to behavioral health care. So what we've always strived to do is to make sure that we have no wrong door approach to providing behavioral health support to people in crisis, people who are having suicidal thoughts or any of those kind of things. part of what we've done now, and we've seen in the last couple of years, is an influx of the need and the necessity for that immediate barrier-free access to behavioral health care because of all of the events in the world that's happening. What we've really tried to do is make a pivot to make sure that those services and resources are accessible 24 hours a day, 7 days a week to anybody, regardless of ability to pay, regardless of status, regardless of any of those other outlier things. So we have a youth connection helpline that kids can either call us, text or chat, because different generations communicate differently and want to access resources differently. So we've acknowledged that in our organizational infrastructure. Part of what we also are doing is making sure that we are providing those 988 services. So for the folks who don't know, 988 is the behavioral health emergency number equivalent to 911. So BHR is going to answer in the state of Missouri about 40% of those phone calls. And so all of those calls will be handled by a clinician who is trained to make sure that that person's immediate needs are met. We can do a safety plan with that person, and then we can make sure that person is connected to other additional long-term supports and resources. What we did figure out in the last couple of years, we launched a crisis response unit with the City of St. Louis Metropolitan Police Department. That immediate access to behavioral health care through that lens has had a tremendous impact on the City of St. Louis and the residents. So we launched that program in February of 21, and to date, we've already engaged with more than 9,000 people. We've been able to divert about 99% of those folks away from the criminal justice system, which would have otherwise been arrested or gone through that process. And we've been able to divert about 91% of those folks away from the hospital systems. The benefit of doing that diversion is that those resources are not being clogged up by people who don't actually need those resources. The hospital systems are open to be able to serve the folks that really need that level of care and support, and the police department are able to use their resources for other activities besides being pseudo behavioral health providers in that space. So we will continue to expand those projects. We're getting ready to expand that program to include a non-police response so that we will be able to do 24-hour a day, 7 days a week, access immediate street triage for anybody that's having a crisis that has had to have a 911 call or police intervention in any kind of way. So that is something that's really important, really intentional about making sure that we've created as many pathways to people accessing behavioral health care as possible.
Thank you. So that's no wrong door approach. This generational approach that you all are putting, I think it's awesome as well, because it makes space for every single person, whether you are an adult or a youth. And I think that is so key here in creating the space. And so all of you all just presented examples of opportunities to do no harm, create space, make it affordable, and bring the access to the communities or to the schools there. So as mental health providers, when you think about assessing these types of programs that you're bringing and the innovation that you're bringing around them, what are some of the things or component parts that you look at in assessing that increased demand for services? Because when I think about behavioral health, we're dealing with this every day. We've got social stressors and systemic racism. We have hate crimes. We see the news. I know the recent election stressed me out when that's all that's coming at me, right? You've got the COVID-19 pandemic that we're still recovering from, and even climate threats of war. What are some of the things that you all look at when you're bringing these programs or these innovations to bear? How do you use, what you're seeing through your patients, through your data to, to bring new services to the forefront? And I'll let anyone take that question first.
Well, I would go ahead and say that like you said, we look at the data to see who are we seeing, what kind of calls are we getting the most, and based off of what's going on in our society at this point in time. I can consider, just like you mentioned, the school shooting last week. I remember that day and that morning as the news was kind of coming out, we were gearing up, okay, well, how are we going to prepare for this? How are we going to make sure that we are visible, that we are supportive in that way? And the weeks of following kind of just being in the forefront of the situation as the information was coming to us. How can best gear up our clinicians and staff to make sure that we're supporting the staff who were impacted, of course, directly, and then the community after that. And so I just appreciate being in a space where we are flexible with the data that we're receiving. And it's hard to say specifically all the different things because, as we know, behavioral health is in every space, right? It is how we live, it is how we exist. And so it could be impacting our youth in different ways. Of course, with the TikTok craze and all of the misinformation and toxic information that's going out that's impacting our youth. So we take that from our staff and staffing cases to say, okay, this is how we want to treat our youth in session, or okay, our crisis services team is saying that they are kind of getting this information. Here's how we want to gear up and prepare staff to treat this, since we're now seeing that it's a need. So I would just say that we're staying flexible with the information and data as it's coming in.
Yeah, I think I would echo that sentiment. I think the data is important. So really being able to tell somebody's clinical story from our first touch point to being able to track what happens to those referrals, how that person is engaged in services beyond our initial contact with them is really important. And I think it's really important for behavioral health organizations to be either fast followers or industry leaders, right? So we are charged with the responsibility of making sure that we are always taking the pulse of what's happening in the world and being responsible to that and being flexible to that, and recognizing that our data is telling a story to us, and then we've got to figure out what to do with that story. So if we're collecting all of this data and we've got all of these clinical outcomes for people, that should tell us exactly what gaps are in our systems and then what changes we need to make to be able to adjust and address those gaps.
Yeah, absolutely. And what we know in the youth space is that the youth suicide rate has increased over 50% since 2017, and since 2019, it's become the second leading cause of death among youth. So we know that those statistics are even worse for youth that are in the child welfare and juvenile justice system, and for LGBT youth. And so we're very keyed into safety assessments. We're having to do safety assessments and risk assessments on elementary school students. We're seeing much more intensive needs at an earlier age. And it's just everyone is stressed. I mean, from school shootings to intruder drills to the rise in homophobic and transphobic rhetoric and attacks. People are just feeling a lot of stress. And one of the things that we've been dealing with, and I'm sure you all have too, is it's affecting our mental health practitioners as well. We're seeing higher rates of stress among our caregivers. And so we have to really look at two-way caring, that it's not just our staff who are caring for our clients, but how do we care for our staff, make time, make space for self-care for them, flexible schedules, and the mental health support that they need as they're dealing with the same issues, many of the same issues that our clients are.
Yeah, I'll just speak to certainly lessons learned from the school shooting. The department was able to take the really shift and take the lead on ensuring that we had coverage where coverage was needed. We were working in real time in conversation with the school. The requests were coming in for in-person services. And so we had to shift to find providers that could provide us with staff that could go into the schools. And then there were other schools that wanted virtual. And so we were really grateful to our partners in the community, BHR, BJC, Hopewell, that real at Places for People that really stepped up and took that charge. And not only did the department have to shift in what we were doing, it was not our usual way of disaster preparedness. We have a disaster response piece to the Department of Mental Health. And the typical way that the disaster response responds is to just kind of be a support if something is needed, not to actually coordinate. So this was a new role for us. And we really recognized that we had staff that were getting completely burnt. It was very traumatizing to our clinicians to be out there every day. the thing that was nice with the Department of Mental Health is because we can then pull in resources from around the state. And we were able to do that and identify those providers out of our region that could provide help to our helpers. We have to give help to our helpers. They have been just in the trenches for not just this, but the whole time of COVID, that all of the additional stressors. You mentioned that all of this political rhetoric that we've just been bombarded with for the last 2 years. It's just created a real need for help for the helpers. And I think that's really a direction that the department is looking at. We're losing far too many people in our field who just are tired. And we have to do what we can do to lift those individuals up.
Yeah, thank you for all of your responses. And Kim, there's a question in the Mentimeter that you just hit on without even realizing it, because one of the questions was, what efforts are being put in place to address the shortage of psychiatrists? So when we think about the help for the helpers, it's also about how are we building a pipeline for more,
Right.
Because is this a space where more and more folks are attracted to go as a career? What's being done to incent individuals to get into this space is way off. So anything that's coming across from your vantage point in terms of building a pipeline for more?
So not necessarily for psychiatrists, but for the department has been looking to encourage individuals to attend junior college, get those 2-year, that certificate. We have partnered with several community colleges to offer the social service certificate to get. We're really short in the direct care staff in all of our facilities. And then also social workers, licensed counselors, encouraging individuals to get into the behavioral health field. It really needs to start in high school. It's got to start in the schools, because if we can't get individuals interested, then they're not going to pursue those career paths when they get out. We have to increase salaries. We just are not competitive. In an area to do that, the department has been addressing pay rates for providers to increase. We are moving away from a fee-based service model to a team-based model, where we are incentivizing agencies to hire more qualified staff, and make the ability to pay staff through our reimbursement mechanisms a more attractive career choice.
Right. That's very helpful. And I think that is some learning that we can all take away, because as we have folks that we interact with on a daily basis, this is certainly a field that's needed, right? It's a service that's needed. It's a gap that's needed, but we're going to need folks to want to move into this space. So thankful for all of you all who are in this space, and who will we help to bring along as more professionals are needed. We'll take one more question while we're in this segment. And here's the question that I'm seeing in the Mentimeter. Is overcoming stigma and generating awareness is easier in school settings? And expand on what is underway in the community at large to encourage people to avail themselves to available services. So what's being done to push this normalization or this awareness, or just, how are we getting more folks to avail themselves?
I think that in general, like the person said, yes, I do think it's easy in school settings, but I do think we can take advantage of social media in a lot of ways and news coverage to make sure that people are aware, because that's where everyone is. And I think that while social media has its disadvantages, it has its advantages because it does touch all ages at this point in time. And so we can share our information and knowledge to the masses at one time with the click of a button to say, hey, if you're suffering, give us a call. Hey, if you're going through this, click this button and fill out this form online and chat with someone. Hey, if you need some support, go to this local resource. It's not us, but we know about them and you should too. And I think that that is just been, for me, so helpful to see how that plays out when we ask people, well, how did you hear about us? How much social media has played a role in that, you know? And even one of my clients, I laughed at her when she said this, but I just never considered. She was like, do you guys have some merch? I think the work you're doing is good and I want a t-shirt and I want to advertise. And so to have people just willing to say that, hey, it's not a stigma anymore. And even I could be a part of this as a recipient of services, but also to encourage people to come here and get the support that I'm receiving. And so I think there are just so many avenues that we didn't have before, which is why we can say confidently that the stigma is reduced.
Great. Yeah, thank you. Thank you. So I do think that's key. We all have to start normalizing this and telling folks that it is okay, right? It's okay to see a counselor. It's okay to make that call. I can say from my own experience, it's like, that's not what, what Black people do, right? So I'm just looking at some of these things that have gone historically within our communities. And so it's like, no, you start to say, no, it's okay. I'm gonna go see one. I go see one. I start putting ourselves out there even more. So appreciate that. So let's talk about streamlined navigation even more now as the next topic for you all to weigh in on this morning. And so when we think about, behavioral health, it is this umbrella term, and it encompasses mental health and substance abuse and conditions. And we talked about these life stressors and stress-related physical symptoms. Behavioral health related social needs also play a role. These things such as housing instability, food insecurity, and exposure to interpersonal violence are often, parallel hallmarks of behavioral health symptoms. And so given this convergence, what gaps and opportunities do you see that we need to focus on as a community to ensure streamlined navigation and access to primary and secondary behavioral health needs? And this is thinking about from a clinical and a social determinant component, because they go hand in hand. Should we be offering that if you're doing job services, should you also be assessed or, offered and say, do you know the services out there? So let's talk a little bit about this in 3 lanes if we can, and thinking about behavioral health and social determinant convergence. Pat, if you can take this from a youth perspective on how to tie these together, followed by Tiffany and LaTanya thinking about adults, and then Kim, with your policy lens, it would be great to hear from you.
Sure. Well, homelessness is definitely a health issue, right? And so for young people, youth and young adults, if they don't have a safe and stable place to live, they're at high risk for violence, for labor and sex trafficking, and other kinds of exploitation, physical and mental health needs just go untreated. So we provide youth in needs for their basic needs first, right? Food, shelter, safety, and then start to build trust. We have a partnership with the Institute for Family Medicine so that they bring in nurse practitioners who can immediately assess for any physical health needs, and they work in partnership with us. I would say some gaps that we see are long-term transitional living programs for older youth and young adults, like that 18, 19 to 25 years old in general, and especially for those who have a serious mental health or substance abuse issues. There just are not, there's not the capacity in this region to meet the need. And I would also say a gap is we have a child welfare and social service system that conflates hardship with harm. And, poverty is not child abuse. Inadequate housing is not neglect. And to better support children, youth, and families, we really need community-based care that's accessible physically and financially and culturally competent to keep kids in communities and with their families. I think that is a huge thing. And last, I would just say that while we have some child-specific funding streams, which are great and very needed and very, very helpful, the parents are struggling too, and it would help kids if we could provide more services for their parents. So I think having more flexibility in funding to be able to serve the whole family would be really helpful as well.
Tiffany and LaTanya, what would you append to that and talk about this from an adult perspective?
Yeah, I mean, Pat really highlighted some of the things that I was going to talk about. I think it's really important for that multi-systemic therapy approach to be more available, more accessible, because to Pat's point, it's one thing to be able to access the children, and there are a lot of things that are happening in the schools and around behavioral health with this younger generation, and they are way ahead of us in terms of having attached themselves to the understanding that behavioral health is health, right? Mental health is health. So they've gotten that part. I think the part that we are missing, or opportunity that we have, is to be able to really close that family system and being able to help that family and the adults within that family also be able to wrap their heads around what behavioral health needs their children have, how to support the children in the family, how to support the other adults in the family. And so I think that's all really important opportunities for us to explore. When you think about in terms of access versus capacity, I think there's an opportunity for us as a behavioral health industry to really understand the difference of those things, because sometimes we talk a lot about building capacity, but capacity does no good if your therapist is only available till 4 o'clock on Monday through Thursday and 12:05, wink wink, on Friday, right? And so you have to be able to provide access so people who are trying to make a living can actually access services after work and on weekends and when it's convenient for them and for their family structures and systems. So I think that's the opportunity for us. In terms of housing, transitional housing and respite housing is always going to be at the top of my list, because a lot of the folks that we interface with our crisis response unit are unhoused. That is just a circle of inability to access a lot of things when you're unhoused. And so us having some access to transitional housing, longer term support, longer term inpatient hospitalizations as necessary, all of those things will be opportunities for us to close some of the gaps in our system of care. And then as an adult, I think one of the really profound things that we as an industry can do is to really help people think about their economic and professional development differently, and for us to look at that from a more equitable lens, and being able to start to hire folks based on competencies instead of just credentials, and getting beyond the idea that you had to go to a certain school and got a certain degree and had to have a certain professor in order for you to do this work. We really want to have people in this space and in this field that have a heart for helping people. Outside of that, everything else can be taught, right? If you got a heart for helping people, we can teach all the rest of the stuff and all of the data collection and report writing and all that other stuff. But us being able to really understand that the competencies are more important, and being able to really impact people's economic status and give them meaningful employment that changes generations, right? And so being able to do that in our system, I think, will be remarkable.
To add to what both Tiffany and Pat already talked about and discussed, I would definitely agree that one of the gaps is access and capacity. I do see more of a capacity issue because the demand for providers is high, but the supply is not so much. And so we see that we can come up with all the creative ideas and resources, but if we don't have enough providers to meet the needs of the callers or people requesting help, we kind of feel that strain with them. It's like, wow, we want to support you, but we can't. All of our people are full. And it kind of right now, again, the positive of since the pandemic is that more people are aware that they need care, but now we're like, wow, we can't even provide the care to everyone because there's just not enough bodies to do so. And so any way it's possible that we can, again, get creative, as Kim talked about earlier, with, recruiting efforts and, pay as a consideration. I do appreciate being a part of training new professionals coming into the field so that they can see that being in the trenches with our people that are most in need is not toxic, and it's not a place to be, and it's a rewarding career to have, or aspect of this career. Mental health, I think, is a big part of what we try to do and try to impact our training counselors and social workers, but also our training mental health nurse practitioners who are in graduate school now, wanting to come out to see, if this isn't what I thought it was, or this isn't a part of the rumors that I heard that working in social service will drain you, it will destroy you. No, this is good work, and we're really impacting the lives of people, and this is something that I want to do because I not had that experience here. So I do think that that's one way we're trying to close that gap with incoming providers who are getting trained now, is to show them that it's things have changed. Even if you heard this from someone in the past, right now we care about your mental health too and your education while you care for others.
Yeah, thank you for that. I was just looking at the questions. I think it is this component of caring for yourselves. You know, how do you recruit, right? Chanella, what you said, mental health is health, but then this capacity component as well in terms of hiring based on competencies and not just credentials. So we all have to get very creative and getting creative and how we continue to broach this as a subject and as a service and as a need and opportunity in our communities. And it brings me to, you know, a question, because we've all just had to be creative going through the COVID-19 pandemic. And that's something that I say, you know, hopefully once in our lifetime, we never have to do that again, but we all had to get creative. We had to do that. One of those most used words ever that we did today, we said the word pivot, right? And looking at that. And so thinking about your respective organizations and your processes as we look at this, can you all speak to the lessons learned in relation to COVID-19? What changed and then what needs to remain the same? Like what would we never go back to in a pre-pandemic state? And I want to start with you, Kim, on that. You know, if you think about some of the things that we learned as a result of that, you know, what should we keep and what should we never return to from a delivery of services model or any topic around the space?
Right. I really appreciate the comments from all three of the ladies on the panel that, you know, in the identifying significant gaps, it's really rewarding for me from a department standpoint to hear that we are in sync on identifying the gaps. And so I really appreciate having heard that from all three of you. I think from a department standpoint, obviously with the emergency declaration, we were able to really pivot the delivery type of services to a lot of more, well, all telehealth or telephonic based services. And I think that was really a switch for those of us who have been in this field for as many years as I have. We've always had that mindset that you couldn't establish rapport with a client without that face-to-face contact. And I think the pandemic really showed us that that's not necessarily the case. I think we will always have those individuals who do so much better in that personalized one-to-one space. But I think that we've found that we can be effective through telehealth. We can be effective through telephonic services. We can rely on the use of apps, the Get Help apps, the MOAD apps. We really have seen an increase in the use of those types of virtual platforms. And so I would say that we don't want those opportunities to go away. We want to continue to use those kinds of electronic type devices. But we also found, major lesson learned through all of this, that not everyone has access. You think in this day and age that everybody has a phone and everybody has a smartphone where they can access those types of services. And that is not the case. And especially in our areas where there is a disparity in service delivery, we found it very, very difficult to provide those electronic-based services. So I think that that's definitely an avenue that we can continue to utilize, but also we need to recognize that we need to go to the community. We need to go where people are. And this idea of everybody coming to us, I think is really going to be a thing of the past.
Thank you for that. Thanks. So, Pat, would you add on anything from the school lens and the youth lens about what would stay the same, or, what should we never go back to?
Sure. I think we've learned just how very important schools are for everybody, for kids and families that we serve, for our staff. Most of our staff at Youth in Need are parents of school-age children. And so not only is it like that safe caregiving, so parents can work, but it's where a lot of kids get their meals, peer relationships, access to mental health care in many cases. And so I know that it's very hard to balance all those needs when you're in this public health crisis, and that had to take precedence, but it really had a negative impact. And I would just, I think that we will be slower and more cautious about closing schools for an extended period of time. I'm not the one who makes those calls, but in talking to schools, I really think everybody is realizing that. Telehealth, we pivoted quickly to telehealth, and that was great. And we'll continue to offer that as an option, but we have found with kids, it's not really that effective. They really do not engage that well. But we have found the flexibility, again, meeting people where they are. So for kids to be, to have a scheduled telehealth appointment, that is not really, they're going to no-show probably half the time. But if we schedule office hours, whether that's in person or virtually, that they can drop in or text when they want to chat, different things like that, to really meet them where they are when they need the services. For that, we do need more flexible funding, right? Funders in a fee-for-service model, we don't get paid if a client doesn't show. And with people who live sometimes lives where there's a lot going on, it makes it hard to schedule an appointment and keep it. I would say also we've doubled down on our commitment to racial equity, and that has just we were already committed and are even more committed to really look at who is the most impacted, really engaging and truly listening to and uplifting the voices of those who've been the most marginalized, not only within the context of a counseling session with individuals, but in how we design and implement programs.
Yeah, thank you for that. So you both hit on something in this question, because it reminds me of, this need for one systems change when looking at this end-to-end process. We're thinking about, I'm hearing digital divide, right? I'm hearing meeting people where they are, the different layers that had to come forward because of COVID-19, taking the services more to the individuals. You're in the schools or taking them to the community. And so having these lenses to do this both and model is something definitely, I think, as a something to think about, whether the funding is there to support that, how can shifts be made, but all of this moves toward getting the services right at the feet of individuals, and right in front of them. So thank you both on that piece. And I could probably say there's likely collaboration there. There's a table to be set on that conversation. And then thinking about, the access component, I want to turn to Tiffany and Tanya, because I know that through COVID, 211 saw a 300% increase in calls for people just seeking counseling services and other treatments for behavioral health crisis, domestic violence, a number of things that, because we were all isolated and together, we were all at home, and this led to, just this increased need. What have you seen, and how have you all pivoted? One, to the increased demand at that time. Has it gone down, or are you still seeing additional trends even today?
I would of course, say that we pivoted to telehealth pretty quickly and rapidly and tried to provide as much training to our staff to make sure that they were ready to provide services in person, not in person, but virtually, that had not traditionally been provided that way. Doing what Pat said, just one of the challenges was, okay, well, youth are not engaged. How do you get a 5-year-old to engage in play therapy through the screen? And I think we did a great job of trying to share resources online, trying to just help equip each other the best way we could while keeping everyone safe and distanced. Another thing that we had was a telehealth office at each location, where if people they were in a poor service area or did not have the technology, they can come and have in a single office themselves to video their provider, whether or not they were in the building or at home, to keep that safety component of health safety there, to try to make sure that people missing out on the therapy services that they need or the psychiatric medication management appointments that they need at the time. So we definitely tried to, again, remain flexible as we were getting more information from people and calls about, where people struggling, how are they not getting on, where are our poor service areas, what are we willing to do, how can we help people, find safe places to do their telehealth appointments at the library, in a car maybe, instead of inside of the library, so that you can still remain engaged in your therapy appointments. I do also think that we are continuing our training as well as we have more and more people come in person. We continue to consider that telehealth is still a thing. And so how can we do both really well? How can we still meet people's needs? And so again, our telehealth offices are still set up for those who may need it. I appreciate, and I give this anecdote, that we had a woman who, because of the chaos her home, really needed in person, but then the gas prices spiked this summer. So she shifted to telehealth really quickly in a kind of phone call, but I appreciated that in that moment, like, wow, look at the ability for her to still meet her needs. She doesn't have to come to the office when she didn't have the funds to do so, and that she could still get the support that she was needing in her, counseling session. And so I think that having that kind of, like you said, both and idea behind that these things we can kind of holistically meet people's needs I don't know, it's just a good thing. And I think that that's here to stay.
Yeah,
We did a lot of the similar things to Latanya's organization. So we went fully remote. Our contact center staff is 100% remote at this point. That allowed for us to maintain our 24-hour access to services without the staff having, being impacted by their fear or interest or inability to come into the office to provide those services. So that was something that will remain. That's something that we've been able to see has a positive impact on the staff, and their ability to be flexible and work from home has increased their interest in remaining with us, which is important during a workforce shortage issue. So that worked out for us very well. We did see an increase in call volume and text and chat. So we really made sure that we streamline our services so that our internal operations were as succinct and streamlined as possible, because every call is important, because we save lives when we answer the phone. So we wanted to make sure that we did everything that we could to make sure we were leveraging our human capital in the best way possible. And so we've done that. All of those changes will, remain with us. Telehealth, it was also something that we pivoted to really quickly. We've had the ability to do that. COVID definitely showed us that we had more capacity and more access issues that we needed to address via telehealth. Our mobile outreach teams were also able to pivot to doing some telephonic interventions. I think having the flexibility from DMH, allowing some of those different telepathic treatment modalities was really helpful during that time, because again, everybody was in a different space and place with their comfort level or access to resources or transport. One of the other things that came out of our crisis response unit was, when everything else in the world was closed, there were a few places that were still open during the pandemic that interface with a lot of our populations. So we started getting calls and requests for partnerships from Schnooks in the city. So we've got a partnership with them. We went in and trained their staff on mental health first aid, because they're engaging with our consumers and people on a regular basis that need support. The public library. So we have a partnership with the St. Louis Public Library System now, so that when folks go to those safe spaces, they have access to behavioral health care, and those workers in those library systems know to call BHR when there is a crisis, or when they have a person come in that they know is like, oh, I know this person, needs connections to resources. So we've been able to do that. Our community improvement districts throughout the city started calling us, so we've got a partnership with them, trying to figure out some of those hotspot areas where people were congregating and figuring out how to access those folks and get them connected to resources. So all in all, a lot of those things are going to stay in place and remain. I think what COVID taught us more than anything was that everybody needed a human touch. And so having an ability and having staff that were interested in still providing some of those face-to-face touches when it was necessary was really critical. And I think that really helped us to maintain some connections and keep some folks connected to services in a way that would not have happened if it was not for those face-to-face touches when it was necessary. Because again, everybody doesn't have access to cell phones and Wi-Fi and, you know, text and chatting and us. So we were really responsive to whatever was happening in the community.
Yeah, no, I think that's great. You know, thank you for that. I mean, all of you answered the questions beautifully about what we learned and what we would take forward, because there's certainly some things, and I personally always say, you know, COVID was bad as it has been. You know, there's good that comes out of it, right? There's something that we can take forward and that we can learn from and keep it going. And so we want to definitely concentrate on the good things, and you all have captured that beautifully in your models and keeping the services moving and making them accessible for everyone. There's a question here in the Mentimeter, and it says that age is rarely included in the DEI equation. The stressors brought on by the COVID-19 pandemic have increased mental health service needs for older adults. Fewer than 50% of older adults receive treatment. Tell us how you are addressing older adult needs. So I thought that's interesting, because I know we talked, you know, texting and telehealth and others. Is there something more or something you might focus on differently for older adults?
I'll say this, there are some initiatives for the older adults, and that's been historical, right? That population has not gotten the services and the support that they need in this behavioral health space, because it's just, you know, it's just been a population that's gotten caught up in the general service providers. So there are some initiatives. There's a team of folks getting together, a collaborative team of providers coming together, and we just submitted for some funding to be able to provide some specific supports and behavioral health services to those older populations, and to be able to craft that so that it looks differently, because they're not doing the same things, right? So we can't spoon feed them vocational services when in any other situation you would be retired at this age. And so being able to have some flexibility with funding is really going to impact our ability to be flexible with service delivery and making sure we take care of different populations. But there are some initiatives going on right now in the space for that population in particular.
That's awesome. That's great to know. Great to know. Anyone else have anything else to add?
Well, I haven't mentioned much about our Mary Ryder home. I'm not sure if you guys are aware, but it's a residential care facility for women 55 and older with a diagnosable mental illness. And so we are definitely interested in the care and support of older adults. And we're starting our kind of initiatives with Mary Ryder Home and Providence so that we can continue to expand. And what does this look like in the community? First with our ladies in the home, and how can we expand those services? And so, yeah, things are starting. I know that the community isn't aware that space is kind of curating in the background, but yeah, things will definitely be coming down the pipeline.
Great. So I love the learning, and I love the exposure that we're getting to the programs and to the, you know, the changes and what's to come. So definitely appreciate that. So we're going to move on to our next segment. We've got about 27 minutes left, and we've covered, you know, the first two segments. So now we're going to round out the final segment, which we talk a little bit more about normalizing behavioral health. We talked about this a bit more already, right? How important it is to normalize this, to tell the community that it is okay to have the services to underpin as demand will increase and grow, even though it's already increasing it. But, you know, building on more opportunities to bring our families and our neighbors, to bring our friends along, but also to bring ourselves along too. And so when we think about the normalization of behavioral health, and again, health, you know, behavioral health is health. You know, something that I want to definitely make sure we all take away from an audience perspective. This question is for all of you. What new initiatives exist or should exist? So you talked a lot about some things that you've already done, but are there even things that you haven't mentioned or things that you'd like to pursue, like perhaps broadening mental health first aid training across all communities? You know, what are some of the things that you would want us to know about, to promote, and to strengthen mental health well-being in our own families, in our own workplaces, in our own communities? And anyone can start the answer to that question.
Well, I'll start because my thoughts are a little more general, just to whatever initiative there is and ideas and gaps that we can provide. I do think it's important that in attracting people that we send the message that mental health is health and that mental health is not disorderly all the time, and that our experiences are just our experiences. And I think that that's what deters people from engaging with care, that depression after delivering a child or giving birth to a child is actually normal. It's an experience. Your hormones are out of alignment that they normally are, and there's nothing wrong with you, that other women experience this. So hey, come talk to someone. It doesn't mean that you are disorderly. I think as we deliver our messages in whichever capacity that we do so, I think it's important to ensure that people understand that help is help for your experience, and not that if I seek help, I am then disorderly. And I do still see a lot of that in the clients and people that we serve, that once they show up, they're like, am I crazy? Am I this? I mean, I'm here, but do you think, even though the stigma is reduced, I think in any ways that we increase care or access to or our messaging to the community, I think that we should consider making sure that people understand that our experiences are what require help, not that in our field we address things that are disorderly, but we also just care about you as a human and that we're here for that. And so that's kind of my perspective on, again, whatever initiatives may arise.
I love that, Tanya. I do think a good thing that came with the pandemic is that it seemed to really spur a national conversation about mental health. And you see more and more celebrities and different people saying, I'm not okay, and I'm in counseling. And I think that is really a big step toward normalizing it. And we do see parents and youth just being much more open and reaching out. So I think that's a really good thing. I do want to just talk about a population that I think is really vulnerable right now, and it's LGBT youth, especially those youth of color and especially transgender youth. They're much more likely to experience homelessness, violence, trauma, depression, suicide, all of the bad stuff. And so I think I would just say, as with anyone whose experiences are different from yours, listen to people, listen to kids and believe them. And know that trans healthcare is primarily mental health care when it comes to kids. And so I think everybody needs to be aware that there's been a lot of bills filed legislatively that would seek to ban gender affirming healthcare, and that could potentially result in mental health professionals being banned from even talking about gender and sexuality issues that kids bring up. So there's a lot of misinformation out there, and so I would just encourage folks to educate themselves and take the opportunity. Thanksgiving is coming. Educate your family about gender identity and expression, and stand up for LGBT kids and youth, and so that they can be in affirming and inclusive environments where they know that they're valued and they belong, which is what we want for all of our young people.
Yeah, great call out, Pat. Great. Anyone else on that particular question?
I wholeheartedly agree with what's been said about normalizing behavioral health. And I do think that that is a positive thing that did come out of the pandemic, is that it's okay to not be okay. And it's okay to say you're not okay. And I think that goes a long way in normalizing behavioral health and making that just a part of general health care. I've seen a real shift and I'm sure others have as well. When you go to see your primary care doctor now, they're asking those questions about depression, about anxiety, asking those questions about, are you safe in your home? Are you having food insecurities? Do you have adequate transportation? Even our medical field is starting to treat the person as a whole, and not these segmented, divided quadrants. We're all whole. We're one person. And all of these things play into making us who we are. And normalizing that, I think it is a huge step, starting with the medical care. Individuals trust their doctors. And going back to the question about how we provide services to older adults, they really trust their doctors. That has been a long-term area of trust, is with their primary care physicians. And so if they make it normal, if they make it okay to talk about, I think that is an area maybe that we concentrate a lot on community getting that message out, but I think we need to also be training up our doctors and APNs to normalize those conversations as well, and for them to be comfortable having those conversations with patients when they come in. That will also help normalize the mental health field. I think that that's certainly an area that the department has been very invested in, is looking at treating the whole person. And we have strongly encouraged collaboration between our federally qualified health centers who provide those primary care, dental, vision services, to also incorporate mental health providers into those, bring them into their facility so that it is a true one-stop shop. That also then works the other way, that when you have individuals, we can't just treat the mental health needs and not treat the medical needs. So we've had this real silo division between behavioral health and primary care. And I think when we start to look at collaboration between both, we'll see the ability to treat the whole person. And so I think that's really a good lesson learned, and definitely a move forward in our field.
Yeah, I would agree with everything that everyone else has already kind of stated. I think a couple of the initiatives that I'm really excited about or look forward to us being able to explore more are around workforce development, and being able to make sure that we have access to people who really want to do this work and have a passion for this work. And particularly looking at it from a lens of equity. So really partnering with certified peer specialists and people with lived experience and community health workers and people in the community that really are invested in the communities that we are serving organically, and giving them a pathway to economic sustainability and empowerment in that way. I think in terms of funding and opportunities to be creative and have more innovation around how our organizations are funded and how our services are funded, I'm looking forward to that, because I think that as our organizations pivot, our funders have not always pivoted. And so it makes it difficult to deliver, innovation and creativity when you're kind of lumped into this box of, you got to do this service in this particular way and this particular person has to deliver it. So I'm looking forward to that change in our system. And then really looking at it from funding from a lens of equity as well. We know that there are disparities in populations and clinical outcomes for specific populations of people, and really putting some funding and resources toward making sure those gaps are closed would be something that would be really pivotal and change and a positive change for the people that we're all committed to serving. And then I think the one thing that I think sometimes we don't take ownership of, all of us being part of breaking down the stigma. This conversation is breaking down the stigma, right? Us being able to have this conversation, to share resources, to share education points, to share lessons learned. Everybody that's a part of this conversation right now is now charged with the ability and the responsibility to have this conversation with somebody else, to share what you learned today, in this conversation with your children, to share it with your neighbor, to tell your story about how you felt maybe after you had your baby or after, whatever your experience was, so that it is not this otherness that we experience all the time. It's easy to other ourselves and other people when we're all just people, right? We're all just people going through this experience, bumping into each other, right? And so I'm just really looking forward to us having more of these kind of conversations and everybody leveraging our humanity to connect with other people and remind everybody that we're all just people.
Yeah, that's great. Let me just say, I love this entire conversation. And I love the learnings and the sound bites. I mean, there's so many of them. And they're not just sound bites, they're lessons, right? They're your lessons learned. There's the wisdom that you are imparting to all of us. And what you've all said in terms of, as we get ready, we're in our last 15 minutes here, to look at, so what do we start taking away from this conversation? What do we start taking away from this dialogue? And that's what we wanted most, is to have the dialogue. That's the whole purpose of having this effort between Focus and United Way, is bringing the conversation back to the forefront. And, Kim, you talked about broadening the system of care, this whole person concept. I'm there, I love it, because we have to look at everything, the whole person, but we have to look at the whole universe, go beyond the presenting needs, and the linkages are there every day, but they're stronger than ever. I think we've learned to see that in order for us to achieve differently, we've got to see it differently. We've got to approach it differently. So bringing in those questions, workforce and more, focusing on individual agencies, communities as a whole, really, really key. And Timmy, you just kind of took us right to the final comment here in terms of about, what are we doing to help advance, the equitable access, streamlining the navigation, and promoting this normalization. Because the final question that I have for all of you is that, coming out of this dialogue today, what should we all do when we leave today's presentation? And Timmy, you just led into that about taking the other out of it, humanizing it, making this something that we live every single day. And so you can start to answer this final question if you want to add anything more to what you said, and then I'll circle back around to the others. That what's our call to action? We didn't just come to have a simple conversation. We came to listen and learn. And I said earlier, sit at your feet, but I also want every one of us to walk away with a call to action coming out of this conversation this morning. So what would you tell us to do, each one of you?
Yeah, I think my, call to action is exactly what I said. Be able to have the conversation and then have the courage to tell your story to somebody else, because then that leads into us feeling more connected and feeling like, oh, I'm not the only person that's experienced this. One thing that typically happens when people are in crisis or anything is happening, we all feel like we're the only person in the world that this has happened to. And we have a natural inclination to feel isolated, when in reality, most people in the world have had some hard experience that they've had to navigate and figure out how to work through and work around. And so we're all connected by our shared ability to be really hard on ourselves and our ability to think that we are just the only people on the planet. And so it's really important for us to remind folks that they are connected, they are valuable, they are touched, they are loved, and all of us have an ability to do that for somebody today.
I love that, Tiffany. You just hit it out of the ballpark. That is fantastic. I think that what I would challenge those on the call on listening in to think about is be vocal. Be vocal about what is missing or what the gaps are or where you see needs in the community. We can't fix or address what we don't know about. And you're your best advocate. So if there are areas that need services or areas where we're not meeting the needs, oh my gosh, please speak up, because without your voice, we have no idea what's going on in the communities. So please be vocal.
To add to that, I would definitely say that we can examine what our personal gaps are in making those happen. And so Tiffany and Kim both talked about using your voice, but I think that oftentimes a lot of people just don't know what to do. And so I think kind of getting out and asking questions of how can I help? What can I do with my time or lack of time? And I know that for things being kind of very busy for everyone in society right now, you can donate funds if you don't actively want to use your voice, if you don't want to volunteer. You can say, hey, I want to call Youth in Need and I want to figure out how I can get more support to the kids in the shelter. I want to call, BHR and figure out how I can support and give supplies to their mobile crisis unit. Or, hey, I'm going to call Provident and figure out how I could give supplies to the after school program or sponsor, $20 for 4 therapy appointments for someone in the Access Center. It's just, we don't understand oftentimes that even when we don't have a lot of money, a little bit of money can give a big resource to someone in need, and that I don't necessarily have to have the time, the energy, or stress about how my voice may not be heard or may not come out in a way. I could just ask questions to figure out how I can be useful to the initiatives that are out here, and then use myself as a vehicle in that way to then communicate with others, or decide when I get more information about how I can be helpful, then to decide how that works in my personal schedule. So yeah, I would challenge everyone to figure out their personal gaps in action and how they could do more to support the community and our programs out here that are trying to give access to everyone.
Yeah, I mean, it's hard to follow what all of you said. That was all really, really excellent. And I think to your point, Latanya, about figuring out what those gaps are, to help you figure that out, like really listen to the people who are most impacted. I think a lot of times we as professionals can come in with what our solutions that we learned in college or learned from textbooks, but you really have to value the lived expertise of people and be humble and curious to best help people and communities.
Yeah, well, thank you all. Thank you for those call to actions and that advice and what we should go, act, do, right, and say. So I want you all to know that this has been I'm going to count this as a jewel of a conversation this morning. The pivot this morning had no impact on the powerful discussion and lessons learned that we've had today. I want to sincerely thank each of you, our expert panel, for helping us to achieve that more in the behavioral health space that we started today's conversation with. Pat, Latanya, Kim, Tiffany, thank you for ensuring that our time together was well spent, super informative and enlightening, but most of all encouraging, and action oriented, so that when we all exit this session, we're going to be right back into the realities of life. But we all need to leave today with a better world, a dream of a better world for behavioral health, a dream of knowing that behavioral health is health, that we all have a responsibility, and that while we want to also bring ourselves to this space, let's bring others with us. And so you all have each set us on a path to do exactly that. And so I am so grateful for the dialogue and for the conversation that we've had. I've learned a lot, and there's a lot for us to take forward. So once again, thank you each for your time today. I want to thank the folks who are on this webinar with us for their time today as well, and hope that you too have learned something that you can take forward, the calls to actions and the things that we've been able to bring forth as a part of this panel. And then once again, I do want to thank the Focus St. Louis team and each of you. Our next opportunity to come together will be Tuesday, March 7th, 2023 at 8:30 a.m. at the Sheldon, where we will be focusing our next dialogue around workforce and transportation. And we will be jointly hosting that as Forum 3 in this series of community dialogues and conversations. So more to come. Everyone, please stay connected via the Focus St. Louis website to register. And most of all today, stay behaviorally healthy. Promote that behavioral health is a part of a healthy community. And I do wish that all of you will stay warm and well today on this cold day that we're all starting to get to as this winter season takes on. So once again, thank you all so much for your time. Thank you for coming and attending today. And thank you to our awesome panelists. Ladies, I love you. Thank you. Thank you to each one of you. So awesome.